just out the gate, does the city's count of COVID cases include Dias and or the jail? And if so, why not? Or why?
Dias numbers are included, and when you talk about the jail, we report right now PCR test, and so we communicate both PCR and antigen tests to the local health authorities.
Okay. And in terms of the numbers themselves, why is the reporting of the numbers so inconsistent from a daily basis?
Well, I'm not sure it's inconsistent. I mean, I think the city, the administration, the health district is still learning as we go. You know, there's 3 different types of tests. You have the gold standard, the PCR test, that's the nasal swab. Well, we're a team, and so tomorrow morning, I'm meeting with the county judge. I'm meeting with the judge pro tem, the city manager, and also healthcare professionals to really talk about. And what we've done since the very beginning is have a collaborative conversation. And so not one entity owns everything, but trying to work together towards the common good. And that is trying to be sure that we can position the county and the city in the best way possible to be responsive to COVID-19.
Why isn't the active number of antigen positives being reported?
A couple different things. So the state only reports the PCR test. Lubbock, for instance, only report the PCR test. Odessa or Ector County, they count antigens and PCR. And so we're going to have a conversation next week of what does that look like? We want to be responsive to both the CDC and the state, but also we want to keep the community here in Abilene informed. And so we look, when I say we, I mean it's the whole team. We look at the PCR positives and antigen positives together and make decisions in that regards. But again, the state only records the PCR test, which is the gold standard.
Okay. And in terms of next week, why is the city saying it won't speak on COVID until next week's city council meeting, even though the situation is fluid and there might need to be some updates in between now and then?
Well, I'm speaking today on COVID. And so I'm ready to answer any and all questions as we speak, so I'm not sure how to answer that. Certainly, I want to be sure that people know that we want to be responsive. You know, I live here in Abilene. Abilene is my home and the home of my family and my mother-in-law, my mother, and so I am concerned like everybody else. It is very fluid. I mean, it changes not just every day, but sometimes multiple times during the day. And so I'm going to interview today because I want to be sure that I'm being responsive to those concerns that exist in our community.
In terms of the funding, how much federal funding is the city getting due to COVID, and does that change depending on the number of cases that continue to come out?
I'm not sure about the formula in regards to the funding formula in that regards, but I can say this. This is a serious matter for our community, and we're not counting nickels and dimes in regards to what our response is. We're going to respond accordingly so we can position this community in the safest position as possible.
Hendrick says that the hospital capacity is a serious issue right now, and what does the city have to say about that?
Well, it's serious. I mean, if you look at our country, our state, I mean, COVID-19 positive have escalated significantly, and so I mean it is a concern. But the public should know. I talked to and the city manager. We talk to healthcare professionals multiple times a day. The health district is engaging multiple times a day here in the region, the city, but also the state and the nation. And so we feel good in regards to capacity now. A true mark will be, I think, next Thursday, next Friday, which is around 21 days after the governor put in the mandate for masks. And so we'll have a good appraisal on how effective that was. When I spoke to officials this morning, they feel pretty good in regards to what projections may look like in the next 7 to 9 days.
And just knowing how active first responders are on a normal basis, but especially during this crazy time we're living in, is there still a COVID outbreak amongst first responders in Abilene?
Well, you know, we had the number of our first responders who were positive, a few months ago. I'm unaware of any other outbreaks within the civil service ranks, but they are our first line of defense, and they are front-facing the community. So it's always a concern. And one message that I want to convey is that, I think that as a community we got a little complacent because we are tired of COVID-19, and we're done with it. The problem is it's not done with us. COVID-19 will be an unwelcome mate for us in the foreseeable future. And so the best thing we can do is learn how to live with it. And that is washing our hands, wearing masks, and more importantly, using common sense.
Why are the state of Texas's hospitalization numbers different than the city's numbers?
Well, I know that there may be a day or two lag in regards to those two numbers. I don't input those numbers, and so I'm not sure about the discrepancy. But I would want to defer to the health district in regards to if there's any inconsistent. I know with numbers to the state that there is a day lag, not just for Abilene, but for all municipalities and counties throughout the state.
Do you believe the lab results are accurate?
I think the PCR test, the gold standard, I think they are very accurate. The challenge is that the PCR tests are some 7, 9, and 10 days. And so I know the medical community wants to be able, and I want them to be able, to react quickly to allow someone to either shelter in place, seek medical attention. We want to be able to address it quickly. The antigen test provides that opportunity. Abilene, Texas, our country is facing a dilemma when it comes to testing. And so I think right now we're responding appropriately. I would love for it to be more PCR tests available because I think that's a better test, a more accurate test.
All right, and obviously, like we were talking about, it's a very fluid situation. This just continues to evolve. Is there anything else at this current time that you would like to get out there?
No, we are constantly, when I say constantly, several times a day, we're doing nothing but talk about COVID-19 and then planning a response. And so tomorrow morning, there'll be a virtual meeting with the county judge, with the judge pro tem, city administration, myself, and healthcare professionals to talk about it more. At that time, we'll have more information. And one thing that we've committed to do is that when we receive information that we think is pertinent and the community needs to know, we've done press conferences, I've done Facebook Live, we sent press releases. We've really tried to be very, very transparent so people will be armed with enough information to be able to take care of themselves. In the end, you and I are responsible for our own health care, and we want to provide enough resources and tools that allows you to manage it effectively.
Great. Mr. Mayor, thank you so much for taking the time. I appreciate it, and stay safe.
Okay, you too. We good?
I believe so.
I'm ready always. It's not 5 o'clock yet, is it?